Hello. Uh, got quite a few questions here tonight. So back home safely. I hope everyone's home safe and not out in the weather. Although hopefully it's going to start to thaw soon because it's been really icy today and quite treacherous and not very nice being out, if you ask me. But still, back home now, and got some questions that we will go over right here and now. So there's some questions that I've already got, and as ever, if anyone's got any questions, they can ask directly. And if you have asked questions in the week, then hopefully I've made a note of them and we'll go over them. So I've got to look over here what the questions are. So how long after breast implant surgery can you fly? Did we not do that last week? I don't know if we did that last week. Anyway, I shall answer it because it's been asked again. Again, I'll open it up to all sorts of surgery because often people want to ask about when you can fly after surgery. There's a particular question about, we did answer this last week actually, didn't I? Anyway, there's a particular thing about breast implants that people worry about breast implants exploding and things. But anyway, the bottom line is I would say there's no limit on it. They're not going to explode. They're not going to get damaged because the pressure of the cabin is pressurized. And if they did, you under enough pressure to damage the implant, it would damage your body more. But you are a bit uncomfortable and you do worry about infection and things like that. So if you're going abroad, it's better to be clear for infection. So you want to wait a couple of weeks to get your wound healed, and you will be sore for about 4 to 6 weeks. So I normally say a couple of months if you're going on holiday and things like that. Leave it a couple of months after having surgery before you fly. You could potentially fly sooner than that, but you might feel a bit uncomfortable. So that's the advice, is a couple of months usually. Silicone patches after tattoo removal surgery. I don't think it's specific to that, but this is a tattoo removal surgery because this patient has got quite thickened red scar, certainly in one area because the scar was really tight. It was here and the scar was really tight in that area. And when you close scars under tension, you do get what's called hypertrophic scars, or red and raised scars, and they can be quite hypertrophic. Hypertrophic scars are usually self-limiting. They usually get better after about 18 months. They can take that long to get better. And silicone dressings can help with that. Massage and moisturising can help with that, but also silicone dressings can help. Silicone dressings come either as a sheet, which is probably the best type, but it can be difficult because it can fall off and things. It's all right if it's on your breast because you can hold it on with your bra, but on your wrist, probably a little bit more difficult to hold the sheets on. So it also comes as a gel, and that might be a bit better. You can't do silicone dressings and moisturising and massage, because if you moisturise and massage it, you'll rub the silicone dressing off. So you do either or. If you're going to use silicone, it's the Doge, hope that stays away. If you do use silicone, you have to put it on for 23 hours a day, so obviously to wash and shower, but you have to have it on all the time, and it can help with these lumpy red scars. Give it a try. There are other things we can do, things like steroid injections and what have you, but we usually wait to the scar to get as good as it's going to get on its own before doing that, because there are potential complications when you start injecting steroid in. Yeah, silicone dressings can help with raised red scars. They're not so good on normal scars. I think a lot of people use them for all scars, but it's not so much evidence for it on a normal scar, but it is good for the red raised scars. Surgery BMI over 30. Yeah, this patient has contacted us because, and I do surgery with a BMI over 30. 30 is an arbitrary cutoff I have for surgery because most of the studies have said that if your BMI is above 30, BMI being your body mass index, which is your weight in kilos divided by your height in meters squared, kilograms per meter squared. And if your BMI is above 30, then you've got a higher rate of complications than if it's below 30. But it's not written in stone. I think when you go for surgery on the NHS, they do have quite strict criteria with the BMI because they have to ration things a bit more than the private sector. But nevertheless, I think it is reasonable to have a cutoff or a setting of BMI, because you are going to have a better result if your BMI can be lower. But I always say that also you've got to be comfortable with your weight. So even if your BMI is below 30 but you want to lose weight, then you should lose weight first. Oh, I'm going to come to that in a minute actually. but it's not written in stone a BMI 30. This patient who contacted us, I think it was over 40. So as I say, I do operate on people who have BMI over 30, but I think over 40 is just too much, and I think you're going to have a really high rate of complications. In fact, I would say that you will get a complication. I think if you do the surgery over 40, you're going to get a complication, whether it be wound healing problem, chest infection, DVT. So it's probably better not to have surgery at that sort of level of BMI, but I would do it at a BMI above 30. The other thing is relative, so sometimes people have had a BMI of 40, 50, and they dropped it down to 35, and so that is when they've dropped it that far, it's not realistic for some people to get to 30. But as a rule, the lower you can get it, the better. And I think above 40 is a bit too high, actually, because I think this was, I can't remember what it was now, whether it was a breast reduction or a tummy tuck or something like that. In fact, actually, it's breast implants, wasn't it? Yeah, which is very unusual for someone with BMI very high to be asking for breast implants. That's another unusual thing. I don't know if it was a typo, because it was usually be a breast reduction rather than implants, because usually people who've got very high BMI don't want implants, but who knows, maybe it was that. What was the next one? We've got quite a lot here, haven't we? So, oh yeah, I've just written how to prepare for breast reduction surgery, because we've got a few questions here from a patient who is considering or booked in for breast reduction, and there's a few questions here which I thought I would go through. How do I prepare for the operation? And the answer to that is, I think there's no specifics. I think a lot of surgeons worry about certain herbal medications. I think some herbal medications can cause bleeding, and they worry about those sorts of things. I don't have any specific guidance for patients with regards to supplements that they may be taking. I haven't. I think what happens is if a surgeon has a bad experience with someone, and they think, oh, that was due to the St. John's wort or something like that, and then they blame it on that, and then they tell everyone not to have it. But I don't have any specific I was about to say specific requirements for that, so I don't have anything that you need to prepare specifically. There is certain medication that I worry about, things like steroids. They do reduce wound healing, but often people can't take steroids, and it's not good, can't stop steroids, sorry, and it's not good to stop steroids, so you have to have a discussion if you're on steroids. The other thing is things like warfarin, which is a blood thinner. If you've had a blood clot, that does increase your risk of bleeding, and so we'd have to talk about stopping that. But again, you have to be careful about stopping it. You might have to have something else instead. So those are the only medications that I worry about. Any other medication, I would say carry on normally. If you're diabetic or heart problems, just take your medication as normal. But obviously talk to us if you're particularly worried. But foods, medicine, vitamin tablets I should take to help with the healing process. No, I would say a good diet. You don't particularly need any vitamin supplements. It's a good diet, but it's good to have a good healthy diet, particularly after surgery, because there's a lot of healing to be done, and so you need to be well nourished. And so a good diet is important. Plenty of fresh fruit and veg, plenty of water. You need to keep yourself regular. The painkillers can cause constipation, which can cause problems, so you need to make sure you're eating and drinking plenty. And the other thing is a positive mindset. I do think that is important. I think it's important to go through all the bad things that can happen when we talk in the clinic, and we'll talk about the complications, the limitations of surgery, what can and can't be achieved, what the scars look like, and I think it's important to be aware of all the bad things that can happen. But if you are going to go ahead with surgery, once you've made a balanced judgment onto whether you're going to have surgery or not, I think it's really important to try and stay positive and to focus on the positives rather than focusing too much on the negatives. I'm always happy to talk about the complications, but I don't think it's healthy to sort of ruminate about it all too much, particularly if you're going to have surgery. If you're thinking surgery is something that you would like, you need to try and focus on the benefits rather than the risks, although you need to be aware of both. But I think a positive mindset, in my experience, is very helpful, and I think patients with a positive mindset do better. But maybe that's not very scientific thing to say, or very but based in evidence. But I think it is good and helpful. Do I need to go for any tests like a mammogram or a scan before the operation? Will I have a checkup before the operation? So I don't routinely mammogram patients prior to breast reduction. If you're of an age where you're having routine mammograms, then that's absolutely fine. But if you're not, then you don't need to have a mammogram pre-surgery. You will have a pre-admission appointment at the hospital prior to the operation, but that will be mainly looking at general things for your anaesthetic, so looking at blood tests and looking at medical history rather than anything specific for the breast reduction surgery. They will, whether you need mammograms after, I've written my answers that I've written to them as well. Yeah, whether you need mammograms after the surgery, then that is fine. You can still have mammograms after having breast reduction surgery or breast augmentation surgery. It is useful to tell them that you've had surgery because they might see the scarring and what have you, which if they know you've had surgery, they can delineate it to be scarring rather than anything like a suspicious area, because you get calcification and things which could be due to scarring rather than anything that they'd worry about. So it's important to tell them that you've got that you've had surgery, but there's absolutely no problem with having a scan after having surgery. The other thing is, we always routinely send your tissue away for histology when we do a breast reduction. It's part of the routine to send the tissue for histology to check there's nothing to worry about in the tissue. So that is a routine part of it. But yes, so you'll have a general checkup, but no particular scans. How do I sleep? How long do I have to sleep on my back? Can I sleep on my side? I have a lot of people asking, when can I stop sleeping on my back? And I don't know who's telling people to sleep on their back, but it's not me. I can understand why people are told to sleep on their back after surgery, particularly breast surgery, because there's swelling, and sleeping on your back, certainly sleeping up, will help with gravity to help the swelling. So I can understand that, but you don't necessarily have to sleep on your back. You can sleep on your side. When you have a breast reduction, you have lots of tapes on which sort of support your breast. We give you a bra as well, which you can wear as well as the tapes if you want. You don't have to, but it just gives a bit of extra support, and I think it is good to have a bit of support when you're sleeping. Obviously, it's uncomfortable to sleep on your front. Even if I said that you could sleep on your front, you probably wouldn't want to sleep on your front. So, but sleeping on your side is fine, but you might find it uncomfortable to sleep on your side. So basically do what's comfortable. So if it's uncomfortable sleeping on your side, don't do it. But if you want to sleep on your side, that's fine. And if you find it uncomfortable sleeping on your back, just sleep on your side. I think it's really important to sleep. I think sleep deprivation is a form of torture. It's really important to get a good night's sleep. So do what is comfortable. If you find that they swell massively overnight, then you might next night want to sit up with a bit and have some pillows. But swelling's not a significant thing after a breast reduction. It is swollen, but I don't think you get significant swelling sort of afterwards due to sleeping and what have you. So I don't make a thing about sleeping on your back. I just say sleep how you're comfortable, which is usually on your side or your back. What should I do to prevent any infection? Good question. Again, positive mindset, healthy eating, keep yourself well nourished. There's a lot of wounds to heal, so you have to eat more than you would normally. Don't smoke. This patient doesn't smoke, but smoking is bad news. That's my blog post for next week. Did it on? I always write them on Monday to publish the following Monday, although I've been a bit out of sync the last couple of weeks. But anyway, don't smoke. In fact, if you smoke, don't have surgery, don't have a breast reduction. It would be my advice to you. If you can't stop smoking, not that I've got any problem with smokers, but it's just that it's just not good for the healing of the skin. It's really bad. So so that's a good thing to prevent infection. Don't smoke. But if you don't smoke anyway, then carry on not smoking. So prevent infection. That's it really. The dressings will be on for a week. After a week, we just get you dressed, get you in the shower. You can wash normally. A lot of people think, oh God, can't get them wet. Can't get my wounds wet. It's a bit old-fashioned, this can't get your wounds wet thing. You can't get them wounds wet when you have it done because the tapes are all on there and you don't want to get them wet. But once the tapes are off, you can get them wet. You can wash and what have you and shower and let the water run. And don't get sort of soap and there's things on them. Although you can wash your hair and stuff. But you can get infection after surgery. But having showers and getting the wounds wet is not going to increase your risk of getting infected. But what we have to do is get it nice and dry, dab it dry or hair dry it dry. You don't want to leave it wet. Similarly, if you have dressings and you do get them wet, give us a ring because we might need to change them. You don't want to stay with wet dressings on because that might make it more risk of getting infections and the wound not healing up nicely because it could get macerated if you have wet dressings on. But actually, having the dressings only on for a week is not going to increase your risk of infection. Having the wounds sort of exposed after a week because the skin's usually pretty well healed after about 4 days. Sometimes it takes a little bit longer at that T-junction, but I usually just give you a bit of gauze for that. How long? Oh, there you go. How long after the operation can I have a bath, stroke shower? Well, there you go. When you first have it done, oh God, the there's quite a lot of here. When you first have it done, you will have these tapes on, so you can sit in a shallow bath, but you can't get those tapes wet, so you can't get it in a shower. So you have to be a bit careful when you first have it done, because those tapes, you can get them sort of splash wet, but you can't really get them soaked, because as I say, then you have to give us a ring, because it'll, you might need to have them changed. So when you first have it done, you have to sit in a shallow bath, but you can't have a shower. After the first week, we take all those dressings off, and you don't need a dressing after that. Then you can bath and shower normally. So you can shower normally and what have you after the first week. This is for a breast reduction. That's that one. And when can I start exercising after the operation? It's a bit like, what was the other one? Was it the driving or playing? Anyway, it's a bit like some other question that I can't remember, which was earlier on, which is just the sleeping, that was it, sleeping, a bit like sleeping. See how you feel. What was the question? Exercising. You probably won't feel like exercising the first week. You probably won't feel like exercising the second week, to be honest with you. After the second week, I think people normally feel a little bit better, start to feel a bit normal, start to get, the anaesthetic's still there, but you're still like feeling a bit better about things, and you can start gentle things. I mean, so walking or what have you, doing straight away. But with regards to sort of exercising like gym activities, I would say after 2 weeks you can start the stepper, you can start the exercise bike, but start gently and see how you go, and gradually build up. Nothing too heavy with your upper body for about a month to 6 weeks, just because you're going to make it swell. Because if you do like weights and things like that. So 4 to 6 weeks for anything too heavy, but 2 weeks you could be doing gentle lower body stuff like the bike and the stepper, but not too much with that with the stepper, just your legs. Regarding weight loss, if I lose more weight after the operation and my breasts go smaller, will I have loose skin around my breasts? Yes, that is the problem, because if you don't really want to lose weight, in fact you don't want to change your weight. I know that's a bit what's the word? A bit hopeful to say don't change your weight after surgery, because weight changes, goes up and down. But ideally, you don't want to have a significant change in your weight after surgery. You want to have a stable weight after surgery, any body contouring surgery, because if you change your weight after surgery, the result can change. And it's particularly the breast reduction, if you do want to lose weight, and I understand a lot of people say, I can't lose weight because I've got enormous weight on my chest, which I can't exercise because it's very uncomfortable to exercise, and I will lose weight once I've had the breast reduction. I understand that concept. But the problem with that is if you lose weight after surgery, first of all, it's an unpredictable effect on your breasts, so your breasts might get smaller, so they might be too small then. A lot of people say, I don't care, I want them really small, so that's not a problem. But the other thing can do is when you lose weight, you lose the fat in the breast, but you don't lose skin, so the breast can droop. Part of a breast reduction is to lift the breast, so you close the skin really tightly. That's why you sometimes get wound problems, wound breakdown, because the skin is closed tightly, because part of the surgery is a lift. The lift is actually an integral part of the reduction. A lot of people say, oh, can I have a lift and a reduction? And you're like, well, they're the same thing. So that is part of the surgery. But if you close the skin really tightly and then you went and lose weight afterwards and you lose volume in your breast, not only will they get smaller, but they might droop a bit. So the shape might not be so good. So yeah, that is another reason to lose the weight first, as well as the BMI thing that I've said earlier about complications and what have you. So yeah, to lose your weight first is the answer, if you can, regardless of BMI. So we're on the last one. Will scar removal cream be provided to me? No, I don't provide scar removal cream. Because I don't think there's any particularly good scar removal cream. I just usually say, thinking about getting creams and things in the clinic though. We have been thinking about that, but anyway, we don't at the moment. The main thing for me, I normally advise people to just moisturise and massage. I leave it for a month before putting any cream on at all. So after a month, then you can start massaging with cream. But I normally say bio oil, Nivea, E45, aloe vera, any sort of moisturising cream. The ones that I was talking about earlier, the silicone ones like Kelacoat, Cica-Care, Sil Gel. These are all the silicone, Dermatix, these are all the silicone ones. They're only really for red, raised, lumpy scars, which is only a small subset really. Not many people get those scars. So for normal scars, it's just massaging with normal moisturiser cream. If you use a normal moisturiser, then you can use that. And but I wait a month after surgery, and I don't provide that cream. So it's just any sort of cream that you've got that you normally use to moisturise. Whoa. I think we've done post-op breast reduction there. That was a good set of questions. Thank you for those questions. That was excellent. I don't know if you can hear the increasing sounds in the background, but I hope you can't. so it gets. I'm sensing dinner's nearly ready. So I'm getting that feeling. So I'm going to check myself out of here before I get rudely interrupted by a family member, and I'm going to preempt the dinner, and I'm going to get myself in there and lay the table. So thanks for joining. I hope there has been something of interest in that. That was a good one. I enjoyed that. That was a good bit of questioning going on in the last week. So if you've got any questions, fire away, get them in, and we'll do it next week. We'll do a bit of, oh crikey, I tell you what, we've got Christmas coming on. What is it, 12th? We're still good next week. We're still good next week. Week after, not so sure. But what's that going to be? Christmas. I'm going to say definitely not over whatever the week after is, because that's Christmas time. No one wants that then, do they? But next week I'm going to be definitely interested in doing this next week. And so I will see you there next week. And I've got a bit list next week actually, so I might be a bit late. But anyway, see you next week at some point. And I'm going to check myself out of here and go and do my family duties. Speak to you next week, and Merry Christmas if I don't see you next week, but if I do see you next week, I'll do that again. Merry Christmas then. Bye.